Okay, we all know that atropine eye drops in various formulations do reduce the progression of myopia. Multiple studies from groups in Singapore, especially Aurelia group, they have done ATOM 1 and ATOM 2 studies. No studies on Indian eye. Having said that, there was a study published 3-4 months back by Dr. Mihir on atropine 1%, but not on low concentration atropine. These are the theories which have been propagated and then nullified, and finally the most comprehensive theory that is doing rounds is atropine affects dopamine neurotransmitter release from various cellular stores and thus may influence retinal signals that control the growth of eye. So Dr. Jyoti Matalia from Narayan Netralaya is doing a study on TL levels of dopamine. However, our paper is on how atropine 0.01% reconstituted. So when we started the study, as Kaushik said, there was no atropine 0.01% drops available, and we did a RCT which was almost for 3 years, and we have been using atropine now almost for 4.5 years. 2 groups, one with 0.01% atropine and another one with no intervention was done. And they were age matched, range of age was 5 to 12 years, spectacles power was between -3 to -8. And all these children were actually on our roll. They showed some document progression of around 0.5 diopter every year, and axial growth was measured at various intervals, and comparison was made at 3-year follow-up. This was a way we prepared reconstituted atropine 0.01%, and either way it is fine. Whatever way you prepare, you should do it in under sterile conditions. And atropine was, they were asked to put atropine once a day in the evening. And so the results shows that a total of 60 children were taken up in 2 groups, 30 in each group. The mean age was comparable, it was around 7.2 years, and the mean axial length in atropine group was lesser than the control group, but it was marginally low. And this was at the end of 1 year, 2 year and 3 years. We can see that although the small, you can see that in the control group the axial length was slightly high, but by the end there was a huge difference between atropine group and control group, and this axial growth was also translated in terms of dioptric power also. This was the mean growth at 1 year, 2 year and 3 years, and this was the mean dioptric difference in atropine group and control group. And since we had only one study which was also on atropine 1%, our rate of progression in Dr. Kothari's study, the rate of progression reduced from 0.6 diopter to 0.02 diopter per year, and this is the only study with higher concentration. If we go to other studies, ATOM 1 was also on similar 1%, and in that 0.28 diopter was reduced in the control group, whereas 1.2 diopter reduction in the atropine group was seen. And the atropine group's mean axial length remained essentially unchanged, whereas the placebo group's mean length increases from 0.39. That was in ATOM 1 study, not in our study. And ATOM 2, which was comparing 1%, 0.1% and 0.01%, you can see that the 0.01% group, though had a slightly higher dioptric change, but it was not a very big change. And you can see the mean myopia progression at 2 years was this much. 0.3 in 1% group and 0.49 in 0.01% group. Now we come to the advantages. Obviously 1% induces significant change in accommodation, and we have to prescribe bifocals or progressive glasses, and patients do complain of photophobia, whereas the chances of systemic side effects are also like fever and flushing are also not there, are almost nil, as we already saw in the previous paper. The retardation of progression doesn't seem to be hugely dose dependent, though there is a difference, but it is not hugely dose dependent, and therefore it is comparable. And now with easy availability, I think atropine 0.01% has a better case. And reconstituted atropine, we conclude that reconstituted atropine eye drops are safe and effective option, and this should be changed to the commercially available atropine 0.01% drops should be safe for preventing progression of myopia. It would need comparisons with higher concentration in Indian eyes, which currently we don't have, and indications for switching to higher concentrations, if any, need to be found out by doing comparisons in these pediatric eye groups. Thank you.
Just one question. What percentage of patients do not respond to 0.01%?
See, there will be some patients, but as I remember, there were only 3 patients who did not respond. We did another study in which we have around 400 patients, which was a longitudinal prospective simple study where we were putting the drops and asking them to put drops and then seeing whether they were responding or not. But there were only 3 patients out of 400 which did not respond to atropine 0.01%. That was very small. So that's the reason when I read your paper, I felt that in our population group, there were not many who were not responding to 0.01%.
Okay.